I'm here with Dr. Birdsong,
Hello.
Doctor of Optometry, and today we're going to talk about eye health. So just to get right into it, Dr. Birdsong, tell us about yourself a little bit.
Well, I graduated from Indiana University School of Optometry. I've been practicing optometry for about 5 years now, and I love what I do.
What do you like about it best?
Well, you get to meet people, you get to help people, and it's in a nice, kind of more laid-back environment.
Not a cubicle style.
Yes, exactly.
Okay, so just get the real general question, why is eye health so important? Like somebody says, it's just your eyes, why is it so important?
Well, a lot of times people don't realize that just because they can see well and they don't actually need glasses, that there is a health side of the eye. In the back of your eye, there's blood vessels, there's nerves, and all that's connected to the rest of you. So it's very important to take care of the health of your body, but they are connected. So
Connected to your whole body, I guess.
Yeah.
So when they say that you can look into a person's eyes and you can tell a lot of things about them,
yes.
Is that true?
That's very much true.
Okay.
We can, tell if you have high cholesterol. We can tell if
just from looking at my eyes.
Just from looking at your eyes. Cholesterol, high blood pressure, diabetes, all those are things that kind of come out nice, even tumors. So there's a lot of things that we can kind of pinpoint to let you know if you're actually healthy.
Wow. So how does diet play a role in your eye health?
Well, diet, just as it would play a role with the health of your body, is also going to affect your eyes. So there's certain foods that you can eat that will be, more beneficial to the eyes. Omega-3s, things like that, they help with dryness of the eye.
Okay.
And your green leafy vegetables, like your collards or kale, that actually helps with you, keeping your retina happy. So yeah, diet is important, but more important to stay away from certain diseases that can affect the eye. Like diabetes is the #1 cause of blindness. Or high blood pressure, that
So you said diabetes is the #1 cause of blindness?
Yes. In America, diabetes is the #1 cause of blindness. A lot of people don't realize that if your sugar is out of whack for a long period of time, the blood vessels in the back of your eye start to leak. And they leak fluids, and they leak fats, and I guess you bleed. So the bleeding leads to the blindness over time.
Wow, that is interesting. So I guess to lead right into that, your diet plays a
huge role. So if you can stay away from diabetes and high blood pressure and all that other stuff that America is so...
Yes, I told you guys about that. So I'm coming in off the street. What would you do to examine my eyes? The person is coming off the street.
Well, first we're going to, we would pre-test you, and pre-testing usually involves getting a rough estimate of your prescription, checking your eye pressure, that little puff of air that you get, that's actually measuring your eye pressure to determine whether you're at risk for glaucoma or not. It doesn't actually diagnose you as having glaucoma, it just lets you know if it's a risk. Then we would actually check and see how well you see, and then we would actually use one of these machines here called a phoropter to, find your prescription, and then we'd use a slit lamp to actually start looking further into the eye and checking the health of the eye.
Very interesting. So going back to the part you said as far as how well you can see, for those of you who don't really understand it, what does 20/20 mean?
Okay, so a lot of things that I hear people think 20/20 is 20/20. That is not what it is. So it doesn't mean that one eye is 20 and one eye is 20, and 20 is just a magical number that's better than everything. It's a little bit more complicated than I'm about to explain, but this is the easiest way to think about it. From a 20-foot distance, okay, that's the first 20. Over 20, I can see a 20-point size letter. Okay? So from a 20-foot distance, I can see this big. Or from a 20-foot distance, I can see this big. Or the big E that's on the chart, which is 2400. And then about 2200 is actually considered legally blind. 2200. So you may be legally blind without correction, but when we put glasses on, you probably are, where we try to get you down to 20/20 as best as possible.
So you put up a good point. My high school track coach was legally blind. He never wore glasses, but he still functioned like a normal person. How does that work?
Well, legally blind doesn't actually, mean that you can't see anything. It just means that what you do see is very fuzzy or distorted. You could be legally, like I'm legally blind, I take this off, but I can see you. I see what color shirt you're wearing. It depends on what distance you're at before you would actually lose sight.
Wow. So the next thing I want to know, I heard that smoking can actually affect your eyesight.
Oh yes, just as smoking affects the rest of you.
Mm-hmm.
We don't want to talk about cancers or tumors that can eventually transfer to the eye, but smoking actually does play a part in age-related macular degeneration. Now, the macula is a part of your retina that's responsible for the central vision. So me seeing your face would be controlled by the macula. So it actually is highly affected by smoking. Meaning, imagine you can see everything here, but I can't see your face. There's something completely blocking my seeing face. I mean, how would you read? How would you drive? Things would be very difficult at that point.
Wow. Okay. So something that I've always wondered, I used to know a person who had 2 different colored eyes.
Mm-hmm.
How does that happen?
Well, that's just more genetics than anything, and the way the eye pigments. You would have to be, sometimes it's just one eye is completely different than the other based on genetics, or just the way the pigment of one eye actually looks. Where actually they probably both could be brown, but maybe one has a little less pigment than the other.
Right.
So it just depends.
Do you know how often that happens? Is it kind of
not the actual numbers, but if you saw how close we got to the eye, there's a lot of differences between the 2 eyes, and just us looking with the average person not actually having heterochromia, or what you would consider one eye being different than the other.
Right.
But more than likely, you can just attribute it to genetics.
Okay. So speaking about genetics, so my mother, my sister, my father all wear glasses. Is that me?
Okay.
Is that normal?
You just roll the dice, and you were just lucky.
Oh,
no, it depends. Glasses can be partly genetics, partly environment.
Okay.
How much time you spend doing up close work can start to affect you. Is it a far-sighted prescription, and everybody has far-sightedness, or is it a nearsighted prescription and everyone has nearsightedness, or if it's a mixture? Because more than likely, we're going to get you eventually. So you think you're good now, but you will eventually be sitting in my chair, and we will be putting some glasses on you.
Man, that's okay.
Yeah.
No positivity. Okay. So having said all that, what are some things that a person can do to strengthen their eyes, or that they can, we talk about diet, that a person can eat right. Is there anything else they can do?
Well, I always try to make people realize that glasses, or the need for glasses, is more like, do you need shoes? Glasses are made for the length and shape of your eye. So it doesn't really necessarily mean that your eye isn't healthy just because you need glasses. So if you can separate the two and realize you need to keep your retina healthy, you need to make sure you don't end up with diabetes or high blood pressure. And, just being generally healthy is going to keep the eye healthy.
Okay.
But as far as needing glasses, or there's nothing you can eat. You can't eat your carrots, and it's going to make your prescription.
Yeah, I was heard that carrots are good for eyes.
Yes, vitamin A is good, just like it's good for other things. But at the same time, I don't want people to think, if I eat healthy, I'm going to be cured and I won't need glasses.
Yeah.
So if you think that if you're nearsighted, that's the length of your eye, meaning your eye is now long. Could you imagine your eye getting shorter for any reason? Like you ate something and now, just like how tall you are, you're not going to shrink anytime soon, are you? So more than likely your glasses probably won't change. But it has happened, and there's other reasons why it does happen. But it won't be ever like, I ate all my carrots and I ate my vegetables and now I'm cured and I don't need glasses.
Perfect, right?
But if you want to tell your children that, please feel free to do so.
Exactly. When is it that a person should come into the office? What are some symptoms?
Okay, well, you should always come in and get an eye exam annually. Every year we need to be checking your eyes to make sure that they're healthy. Even if you don't feel anything, the eye can be very silent but show a lot. So it's very important to make sure, even with eye diseases like glaucoma and cataract, things you wouldn't realize is going on, it's good to know that, what's going on.
Right.
Sometimes we're the first people to actually, tell you, hey, you may have diabetes, go get your sugars checked.
Wow.
So every year you need to be coming in. And then if you, as far as some things that could happen, pain behind the eye, pressure changes, or you feel like you're seeing flashes of light or tons of showers or floaters, those are something, or you're missing, vision. Those are things that you should come in, immediately.
That is a lot of good information. That was great. I appreciate it. So this is in the greater Atlanta area. So if somebody wanted to get in contact with you, how would they do that?
Well, currently I'm at iWorks of Atlanta and Decatur. Their location for Decatur is like downtown Decatur area, and we're actually in our Midtown store. And you just come in for an appointment. I'm here Tuesday through Saturday.
There you go. This is Dr. Birdsong. I appreciate it again. Signing off, this is oldfashionedhealth.com. See you next time.